Hello everybody. Today we're going to be doing our key assessment case study for APN 605. Our patient is Jane. She's 14 years old. She has a BMI of 28. This puts her in the 95th percentile for her age and it puts her in the obese category. She presents with elevated blood pressure, 125/82. This can be classified as stage 1 hypertension. She is pre-diabetic with a resting glucose of 116 milligrams per deciliter. She is borderline LDL cholesterol at 113 milligrams per deciliter. Jane has a family history. Her family history includes her mother having issues with hyperlipidemia and a history of obesity. Her father also has a history of obesity and type 2 diabetes. Jane's family history puts her at a high risk for obesity, according to the UCSF Children's Hospital webpage. We also find that a child with one obese parent has a 50% chance of being obese, and when both parents are obese, their children can have an 80% chance of being obese at some point in their life. So family influences weigh heavily in Jane's situation currently. She's also at high risk for hyperlipidemia and type 2 diabetes based on her family history and her current lab results. So we need to look at her BMI, how we calculated it, and where she's at with the rest of her metrics according to the CDC. With her BMI, she calculates out right at 27.98 or 28 on her chart. She's in the 50th percentile for height, which is great. She's average for her height. But she is in the 90th percentile for her weight for age. That means when we look at her calorie needs, we need to calculate her basal metabolic rate. We use the Mifflin-St. Jean equation, and the equation tells us that she should be around 1,500 calories a day based on her basal metabolic rate, assuming that there is normal daily movement and no extra exercise. Her calorie needs to maintain her weight is around 1,850 calories a day. So in order for us to go ahead and get Jane to lose weight, she needs to be under that mark. Now, when we look at her 3-day food log, Jane is currently consuming around 2,700 calories a day. This is 83 grams of protein, 321 grams of carbohydrates, and 126 grams of fat per day. When she's eating 1,450 calories, which is around the calorie deficit level that we want her in, based on her 1,850 for maintenance, this will put her in a healthy 400 calorie a day deficit. She's going to have a ratio of 20% proteins, 50% carbohydrates, and 30% fat. She should be consuming at around 72 grams of protein, 181 grams of carbohydrates, and 48 grams of fat. And you can see the significant difference in the carbohydrates and in the fat. This is what is going to create that big calorie deficit for us. When we look at her micronutrient intake, she's within normal ranges on all of her vitamins and minerals, with the exception of fiber, vitamin D, vitamin E, magnesium, and potassium, which she was lower than 75% of her RDA. And she was high in sodium, sugar, and saturated fats. She was over 150% of her RDA. So we want to make sure that with elimination of the processed foods and eating out that she does, that we get these guys down, and good quality whole foods will go ahead and increase the vitamins and minerals that she's deficient in. So what is our plan? Our plan is to decrease Jane's simple carbohydrate and sodium intake by reducing or eliminating processed foods and eating out. We're going to include plenty of whole grain products as well as snacks that are easy to prepare and cost efficient, so she has good quality choices at home and at school. We're going to focus on quality sources of protein as well as lean animal protein sources to reduce her saturated fat intake, lower her LDL cholesterol, increase her metabolism, and aid in weight loss by helping with satiation while in that calorie deficit. One of the big things that we find with people that are put into a calorie deficit is they feel like they're extremely restricted and they feel like they're hungry all the time. What we want to do is we want to ensure that Jane can go ahead and feel full when she does eat, even though she's getting less calories in. This also doesn't mean that we have to sacrifice volume, which we'll look at when we get to our meal plans. We want to ensure that she has the branched chain and essential amino acid bioavailability in her diet to help support lean tissue growth, immune system function, and proper metabolic functions. We want to make sure that Jane feels like she's eating as often as she likes. Again, going back to the calorie deficit, when she gets hungry, we want to make sure that she feels like she can eat. If she's not hungry, we don't want her feeling like she has to eat. So we're going to have set amounts of foods that she can eat per day and not so much restricted times that she can eat per day. We're going to adjust to a healthy eating pattern and reduce the feelings of restriction as much as possible while at school and while at home. I am going to recommend that she does 30 minutes of walking at moderate intensity 5 days a week, preferably with family or friends, to help increase her calorie burn, improve her endocrine function, and help with circulation. We are also going to recommend that she sees a therapist for at least 3 months. This is going to be helping with the change in lifestyle and nutrition intake, to make sure that she is equipped with the proper coping mechanisms to deal with any unhealthy attachments she may have developed with food, any fears and anxieties that may arise during the process. It's not just the initial change, it's the lifestyle change throughout the process that can cause issues, and we want to be able to address those as they arise, not only with Jane, but also with the family. We're going to give the family and Jane some good resources to help. One of the things that the family expressed was that they have issues with their food budget and feel like they're running out of food towards the end of the month, and they revert to fast foods to save on time and to save on money. So we're going to go ahead and give them resources from My Plate Save More to go ahead and show them how to budget their food. We're also going to show them how to buy quality products at a lower price from the My Plate website. And then we're going to give them information on the SNAP program, not only to help with Jane, but to help with the family's budgeting as well. This will give them a little bit of flexibility with their budgeting for their new nutrition lifestyle, especially for Jane. When we look at her specific meal plan, what we want to do is we want to make sure that we give a little bit of room and plenty of variety in foods to make sure that she can eat what she wants and doesn't feel like she has to be too nitpicky, but is staying within her calorie deficit. As you can see, we have breakfast, lunch, dinner, and snacks that she can eat throughout the day. We are balanced in our proteins, fats, and carbs, and at the end of the day, we're right around 1,400 calories. Sometimes a little bit above, sometimes a little bit below, but we're getting our consistent protein, fat, and carb ratio and meeting our micronutrient needs as well, and giving her a little bit of flexibility within her calorie range to ensure that she stays within a calorie deficit. The biggest success for people that are in weight loss is having support and a plan. So the important behavior changes for Jane's success, obviously family and friends support. We want to make sure that they're the center of everything that we do here. Studies have shown that it's extremely tough to go ahead and lose weight significantly and long term when you're doing it by yourself. When you have support, you're a lot more likely to be successful. So we're going to make sure that family and friends are the centerpiece of that. We are going to focus on nutrition and movement. We're going to combine these two to go ahead and create a sustainable and maintainable calorie deficit. We're going to practice cooking and food preparation. Jane's 14 years old. We need to teach her the necessary life skills to go ahead and pick out foods, prepare them, and consume them healthfully throughout the rest of her life. And then we're going to throw in therapy to make sure that she can deal with any of those issues that arise while she's going through this change process with her family. Bottom line is Jane is 14 years old and is in need of some lifestyle interventions now. I feel that when we do these properly, get her in the proper calorie deficit, teach her proper movements, and get the family support, she'll be successful long term. Thank you.